everyone. I'm Liz Reynolds, registered dietitian, and today we're here to talk all about heart. There are many factors that can affect your chances of getting heart disease. Some of these risk factors can't be changed, like your family history, age, or gender. However, if we pay attention to what we eat, we can make a big impact in prevention. So without further ado, let's get into our 5 tips for heart health. Tip number 1, be sensible about sodium. Many of us have acquired a taste for a high sodium diet without even realizing it. Americans today eat on average about 3,400 milligrams of sodium per day, but the Dietary Guidelines for Americans recommends limiting sodium intake to less than 2,300 milligrams per day as part of a healthy eating pattern. That's equal to about 1 teaspoon of salt a day. So where do we begin? First, it's good to understand where most of our salt intake comes from. About 70% of the sodium Americans consume is from processed foods and restaurant meals. You can try being a label detective. Look for sodium on nutrition facts labels when shopping, especially for processed or packaged foods. Things that tend to be high in sodium include condiments like ketchup, barbecue sauce, snack foods, processed meats like ham, bacon, or brats, and refined grains like breads, crackers, and cereals. When reading your nutrition facts label, try to find items with 140 milligrams or less of sodium per serving. You can also try using less salt while cooking at home. When omitting salt from a recipe, you can try using more spices, fresh herbs, or lemon juice for flavor. When eating out, you can always ask your server if your dish can be prepared without salt in the kitchen. Most restaurants will be happy to try to accommodate your request. Tip number 2, focus on fiber. While most Americans are typically eating too much sodium, most Americans are also not eating nearly enough fiber. Dietary fiber, found mainly in fruits, vegetables, whole grains, and legumes, can provide many health benefits, including supporting digestive health, helping maintain a healthy weight, and lowering your risk of diabetes, heart disease, and some types of cancer. It's recommended to consume about 25 grams of fiber daily for women and about 38 grams daily for men. However, most Americans consume on average about 15 to 16 grams a day. So where can we get more fiber? Adding more fruits and veggies to your day can be the easiest and tastiest way to get more fiber. Often you'll hear the recommendation of make half your plate fruits and vegetables, but start where you're at. Try enjoying a fruit like frozen berries or apple slices with your breakfast or snack. Roast root vegetables as a side dish for dinner. Or steam frozen veggie mix to toss with your pasta or into a casserole. Work your way up to half your plate as you discover new fruits and veggies you love and recipes that make them taste great. You can also try choosing whole grains over processed or refined grains. Easy swaps can include whole wheat bread over white bread, brown rice over white, or whole grain pasta over regular. Nuts, seeds, beans, and other legumes can also be great sources of fiber. These types of high fiber proteins can take center stage on your plate if you're looking to eat more plant-based. Tip number 3, know your fats. Fats are an important nutrient your body needs, and there are 3 types of fats found in food we eat: unsaturated fat, saturated fat, and trans fat. Different fats have different effects on our blood cholesterol levels. Unsaturated fats are often referred to as healthy fats. These are found in vegetable oils, nuts, seeds, and fatty fish. Unsaturated fat will help reduce your bad cholesterol and help reduce your overall risk for heart disease. Saturated fats are found in meats, dairies, and tropical oils like coconut or palm oil. These fats increase your bad cholesterol and increase your risk for heart disease and stroke. They should be eaten in limited amounts. Choosing lean meats and plant-based proteins can be a great way to limit your saturated fats. The final type of fat found in food is trans fats. These fats increase your bad cholesterol and lower your good cholesterol. These increase your risk for heart disease and should be avoided as much as possible. You might find trans fats in donuts, cakes, pie crusts, margarine, or shortening. Read the nutrition facts label and choose foods with 0 grams of trans fats. You can also read ingredient lists and avoid foods that contain partially hydrogenated oils or hydrogenated oils. Tip number 4, look for lean proteins. Protein foods include things like meat, poultry, fish, and seafood, beans, eggs, nuts, and seeds. Most of us are eating enough protein every day to meet our needs, but what we can do is think about the type of proteins we choose and focus on more lean or plant-based protein sources more often. You can shop for leaner options like chicken, turkey, or fish, or choose meats that are lean select cuts rather than prime or choice. You can also trim visible fat and skin before you start cooking. Consider trying meatless meals 1 to 2 times per week to further lower your fat intake and increase your fiber. Tip number 5, learn to spot added sugar. Keeping tabs on how much sugar you're eating or drinking is an important part of a heart-healthy lifestyle, especially if you've been diagnosed with diabetes or prediabetes. Sugars in your diet can be naturally occurring or added. Naturally occurring sugars are found naturally in foods like fruit or milk. Added sugars are sugars or syrups that's put into food during preparation or processing. The major sources of added sugars are regular soft drinks, candy, cakes, cookies, pies, and fruit drinks. Dairy desserts and milk products like ice cream, sweetened yogurt, or sweetened milk, and other grains like sweet cereals. Compare food labels and choose products with the lowest amount of added sugars. And those are your 5 tips for eating for heart health. Keeping our hearts healthy can go beyond our plates as well. We can move more and sit less. We can quit smoking, and we can know our numbers. We can visit our doctor annually to get screened, or if we're in the United States, we can participate in the HRA program annually to stay informed about our heart health. You can find more resources at the Wellness Library on Pulse, or visit the American Heart Association's website at heart.org. Stick around for a quick message about the HRA program for employees in the United States.
Hey team, it's time for our annual health risk assessment program. Our HRA program is a great way to gain deeper insights into the state of your health. In addition, we have several financial incentives for participating, such as a benefit credit on your 2022 medical plan contributions and wellness points. Completing the HRA program is as easy as 1, 2, 3. Step 1. Complete your health assessment questionnaire. Step 2. Sign up for a biometric screening. This year we have 4 options to choose from, so sign up soon as appointments fill up fast. Step 3. Schedule a 15-minute coaching call to review your results. Make sure this is scheduled for a few weeks after you've completed your biometric screening. We recommend that you complete Step 1 and schedule Steps 2 and 3 all in one visit to the portal so you don't forget. Due dates are important. This program is active only for a limited period, so don't delay and sign up today.